Good afternoon. Welcome to today's update on New Brunswick's return to school plan. Bonjour tout le monde et bienvenue à cette mise à jour.
Good afternoon and welcome to this update on return to school plan. We have the Minister of Education and Early Childhood Development, Dominic Cardy, and Dr. Jennifer Russell.
Minister of Education and Early Childhood Development, Dominic Cardy, and Dr. Jennifer Russell, the province's Chief Medical Officer. Minister Cardy?
Thank you, Danielle. Thank you very much, Dr. Russell, again, for being here today. So, this is the end of the beginning in terms of back-to-school plans as we get ready for a return to classes in a few weeks' time. So I want to thank you for what's going to be the first of several updates that are going to take place over the next few weeks on our return to school plan that was first shared several months ago. So, je vais commencer par...
I will start with thanking Dr. Russell for being here with us today to discuss the back-to-school plan. It is the first of a few updates that we will have. In June, I was pleased to be one of the first education ministers in Canada to release a high-level return-to-school plan to the public.
Return-to-school plan. And at the Department of Education and Early Childhood Development, we understood that even though school had just officially ended for the year, that students and parents were already thinking ahead to this September. And we have, of course, all been faced with anxiety and uncertainties as we navigate the COVID-19 pandemic. And that's why we've tried as much as possible over the summer as all this work is going on to provide updates on what we've been doing inside the department, the work at the districts, and down to the school level. But I know and I understand that parents and students still have many, many questions. So throughout the summer, teachers across the province had the opportunity to participate in professional learning opportunities to help them prepare for the school year. We've been working closely with the school district and the schools to make sure that they're ready to implement these new health and safety measures that are the focus of the briefing today. So nous avons collaboré de près avec.
We've been working closely with the school districts and the schools to ensure they're prepared to implement these health and safety measures.
Principals of all 294 schools across the province wanted to make sure we had those before this briefing to make sure they could share that information with their teaching staff, because we have to show respect for our teachers by making sure they have the information that, of course, they're going to be required to implement and manage in their classrooms. So we met with all of those 294 principals to give them the tools and the knowledge that they require to finalize and implement their COVID-19 operational plans in their schools. Il y a eu plusieurs.
So we had meetings with principals from the 294 schools across the province to provide them with the tools and knowledge they require to finalize and implement their COVID-19 operational plans in schools across the province.
The coming weeks leading up to, and if necessary after school starts up again, we're going to have these regular bi-weekly press conferences and other sorts of new availabilities to answer questions. And of course, schools at the local level are going to be sharing their individual operational plans. But I will ask that parents continue to be patient. I know that you have got anxieties, but I assure you that we are working and doing our absolute best to ensure the safety of students and of all of our staff. We've been working very closely with Dr. Russell and her office as we've defined and refined and further developed our return to school plan to make sure that our preparations are carried out using the most up-to-date scientific information. While our mandate continues, of course, to be providing students with quality, inclusive education, we know that students can't be positioned for long-term success if our educators and our learners don't feel safe. Alors, notre mandat, ça reste le même, de fournir aux élèves une éducation.
While our mandate continues to be providing students with quality, inclusive education, we know that students cannot be positioned for long-term success if our educators and learners do not first feel safe. I said this in June, and it is worth saying again today. This update will not address every single question every single person has about the 2020-21 school year.
In June, I said it multiple times since, and I'll say it again today, that this address this update is not going to address every single question that every parent, every student will have about the coming school year. But over the course of the coming weeks, I'm going to do my absolute best to answer every single question through those multiple opportunities. There are going to be other questions, and we're going to have other sessions to talk about how the classroom bubbles work, how reduced group sizes are going to work, what blended learning is going to look like for high school students, and our plans for integrating technology and personalized learning into the classroom. So again, coming weeks, I'll get to as many of your questions as I possibly can. Because there are many aspects to this plan. As I said, way too many to go through in one news conference. And we're going to continue throughout as well to work with public health to meet the needs of students and staff as the situation changes and new information is presented. So today, the purpose of today's briefing is to give an overview of the new details in the plan and to answer some questions around safety measures in schools. So let's get going. As of September, students of all ages will need to bring a clean face mask to school with them every day. Face masks are not going to be required inside the classroom while students are working, if physical distancing can be maintained. À compter de septembre, les élèves de tous les âges devront...
As of September, students of all ages will need to bring a clean face mask with them to school every day. Face masks will not be required inside the classroom while students are working if physical distancing can be maintained.
In kindergarten and up to grade 5 will be encouraged to wear masks in common areas, such as when they're going to the washrooms or walking in the hallways. They are not going to be required to wear them. I've previously discussed that around the issues of younger students, the difficulties for them of putting the masks on, taking them off, touching their face, their noses, eyes, etc. So that said, we still want those students to have a mask with them. In the event that a student becomes ill at any point during the school day, as the case with our early learning and childcare centers, they'll be required to wear the mask at that point until their parents or guardians arrive to take them home. And at that point, that situation passes over to public health, and Dr. Russell will address those details. Students in grades 6 to 12 are going to be required to wear face masks as they travel through common areas in schools. And based on our discussions with public health, teachers and educators from K to 8 will be able to choose if they'd like to wear a face mask or a shield with a mask within their classroom bubble, but they will not be required. Because as we've talked about over and over again as a province, and Dr. Russell has been incredibly effective in getting this message out, the best way to keep COVID-19 out of our schools is to keep COVID-19 out of our province. So this is how we can all help. In the high school setting, where students are not bubbled in classes so they can be allowed to have a more personalized learning experience, taking the optional classes that define the difference between high school and other ages, teachers will be required to physically distance from students. If they can't distance themselves for whatever reason, they'll be required to wear a mask. These same rules all apply to the use of public school buses. Ces mêmes règles s'appliquent aux élèves qui prennent l'autobus scolaire. Younger students who are not required to wear a mask will sit alone or with a member of their household. Older students will be able to sit 2 to a seat, but they will be required to wear a mask whenever they're sharing their seat, in addition to wearing them while embarking and disembarking. Clear curtains are going to be installed in the buses to provide a physical barrier with the bus driver when students get on and off of the bus. And if physical distancing is not possible, the bus driver will be required to wear a face mask or a shield with a mask. Students will sit in the same seat every day on the school bus to facilitate contact tracing if that ever becomes required. And to reduce congestion and to promote physical distancing whenever possible, buses are going to be filled from the back to the front. And that way students will not have to pass each other while getting on and off the bus. To keep our schools healthy and safe, guidelines around illness must be followed by staff and students throughout the year. If a student is ill, they must stay home. Teachers will be able to work with students on an individual basis to make sure they're able to make up any work that they have missed in class. But let me be clear about this. This is nothing new for our education system. We've got outstanding, motivated teachers who've been meeting the needs of our students for years, regardless of their individual circumstances. And I have every confidence that they have got the training and, of course, the passion to continue carrying out their exceptional work. Je tiens à préciser que ce n'est rien de nouveau pour notre système d'éducation.
Let me be clear, this is nothing new for the education system. We have outstanding, motivated teachers who have been meeting the needs of our students for years, regardless of individual circumstances. I'm confident they have the training and passion to continue carrying out their exceptional work. So that means that parents will have to be vigilant in monitoring the health of their children, which Dr. Russell will speak to momentarily.
Extra vigilant, monitoring the health of their children, and Dr. Russell will get into the details around that momentarily. Preparing students for the future is what everyone in our education system does best, and our teachers are going to work with the students so they're prepared for life during the reality of this pandemic. Students are going to be taught age-appropriate ways to reduce physical contact and to promote hygiene. They will be taught how to wear their masks properly and reminded not to touch their faces. Families and staff can also anticipate several changes within schools. So depending on each school's operational plan, there may be arrows on the floor to direct traffic within the school, limits to the number of students or staff who can be in a given common area, such as a washroom or break area, and designated doors for entry and exit. Hand sanitizing dispensers will be placed at school entrances and in every classroom. Students are expected to sanitize their hands whenever they enter a school or classroom. Students must be prepared to bring a clean water bottle with them every day, as our drinking fountains are being replaced with water bottle filling stations. So departmental staff have spent a huge amount of time working with health and safety experts, with WorkSafe MB, to develop strenuous cleaning and disinfecting protocols. Le personnel du ministère a consacré beaucoup de temps à travailler avec les experts en santé et en sécurité de travail.
Department staff has spent a lot of time working with health and safety experts with WorkSafe NB to develop strenuous cleaning and disinfecting protocols.
Videos for custodians and bus drivers, so they're prepared to implement these new directives. We're making a few changes to cleaning schedules so that families can know what to expect. Those are going to include commonly touched areas, such as doorknobs, for example, will be cleaned regularly throughout the day. This is going to include cafeteria and eating areas, which are going to be cleaned between uses. Personal spaces, such as desks or lockers, will be cleaned daily, and change rooms cleaned a minimum of 3 times a day. We've got just under 300 schools across our province, and each with its own infrastructure, each with its own special culture. And so that means that there's no one-size-fits-all plan. So we'll have more details on specific school cleaning protocols. Those will be shared with each individual operational plan that each school is developing. Alors, nous avons près de 300
We have nearly 300 schools across the province, each with its own infrastructure and culture. This means there is no one-size-fits-all plan. More details on specific school cleaning protocols will be outlined in individual operational plans.
There are going to be a number of restrictions on who can enter into schools. Visitors are only going to be allowed entry if they have an appointment approved by the principal. So that means that parents can expect their communications with teachers to be more technology-based during this coming year than they have been in the past. I know that thought might not give families a lot of comfort as they think about the home learning options that were on offer between March and June of this year. But I've said it again, and I will repeat it again today, that what we experienced between March and June was not ideal. It was an emergency response to an emergency situation. And we've spent the intervening months making sure we're well prepared for dealing with COVID-19 with a much higher level of educational rigor as we move into this fall. But regardless of that, I want to take a moment to again thank the teachers who throughout that period did go above and beyond, who reached out to parents, to families, who embraced new technologies and new teaching methods. And that, to me, is what is going to make our system succeed through this pandemic, is the strength and the resilience and professionalism of our classroom teachers. So
I have said it once and I will say it again. Last spring was not a perfect system, not at all. Regardless, I've been so proud to hear stories of educators going above and beyond to support student learning. Across the province, our teachers worked hard. embraced new methods, and added new tools to the educational toolbox. I am so grateful for the outstanding work and devotion so many of you have shown throughout the pandemic.
Outstanding work and devotion so many of you have shown throughout the pandemic. And furthermore, the pandemic, of course, it's constantly evolving. Our plans have to evolve with it. We have to be flexible, adaptable, and ready to change when new information becomes available. Comme vous le savez, la situation de pandémie évolue sans cesse.
The pandemic situation is constantly evolving. Our plans must be flexible, adaptable, and we must be ready to change with the situation or when new information is presented.
Russell is going to elaborate a little bit more on what parents can expect from public health in the unfortunate event of our province experiencing another outbreak in the school or in a community. But in the event that students are sent home to isolate, whether that includes a single student, a class, or an entire school, full-time learning will continue to be mandatory. While certain learning objectives may be prioritized during an outbreak, students will follow their curricula. Students from kindergarten to grade 2 will be provided with paper-based materials and work packages to complete from home, and teachers will check in with them daily. That will be required. Similar packages will be reproduced for students in grade 3 to 5 and will be supplemented with some technology learning. Teachers will develop a teaching routine with students and stay up to date on their progress. Older students, so students from grade 6 to 12, will use technology-based distance learning full-time with their teachers throughout the school day. So for high school students, the blended learning model will support this approach as they follow a more personalized learning strategies, focusing on project-based learning that builds on their interests. This is a lot of information to explain in one shot. And that's again why I've made the commitment that I'll be back here at least twice a week to share more information on this and other topics and to get into as much depth as required. In the meantime, don't hesitate to reach out to the department. You can reach out to me individually at dominic.carty@gmb.ca, and I'll do my best to get back to you. And I'll take that moment to apologize for any delay in responding to folks over the last month as I whacked my head in early July, and that caused me to required to take time off screens for a few weeks, which caused a backlog of emails. But I promise I'm working to catch up, and everyone will get a reply that I hope answers their questions. Je sais que ce sont beaucoup de renseignements à fournir et à digérer en...
I know this is a lot of information to try and explain in one shot. Once again, that is why we have made the commitment to come back twice a week until the start of the school and explore these topics in more depth. Si nous voulons
feel safe, and we also have to have confidence in our plan. Si nous voulons réussir le retour à l'école en septembre, il est primordial.
For our return to school to be successful, we need families, educators, and school staff to feel safe but also have confidence in our plan. So I will keep returning and answering your questions as best as I can over the coming weeks to give you all a fuller picture of what to expect September 8th.
I will keep on coming back and keep on coming back and keep on answering questions because you deserve it. This is your school system. This is an incredibly anxiety-provoking time. There's a lot of reason to be asking questions. This is not a situation our system has faced before, and I'm going to do my very best to make sure that all of your questions are answered. So between the work that's being put in at the departmental level, with the school districts, with school administrations, and with our teachers, I'm confident that we can safely reopen schools in September. We've got a huge number of motivated and talented educators, our EAs, our teachers, our other support staff, our leads, who I know are going to be able to bridge any gaps in learning over the course of the coming year. So I'd like to take again a moment to thank all of those people in the system, at every level, for their collaboration, their patience, and their understanding. And despite the unfortunate circumstances the world finds itself in today, we've been able to do what New Brunswickers do best, to come together to overcome whatever obstacles thrown in front of us. Malgré les circonstances malheureuses avec lesquelles nous avons...
Despite the unfortunate circumstances, we have been able to do what New Brunswickers do best, come together to overcome whatever obstacles we may face. Thank you, and I invite Dr. Russell to come and share a few words.
For listening to me today. I invite Dr. Russell to come and share a few words, and we'll be happy to take questions afterwards. Thank you so much. Merci beaucoup. Dr. Russell.
Thank you, Minister Cardy. Merci. Good afternoon, everyone. Bonjour. It will soon be September. It's the time of year when children, parents, and teachers prepare for the start of a new school year. But this September won't be like last September or any other school year that we have known. Ce sera très différent pour les familles, les enseignants.
It will be very different for families and teachers and school staff, and that is nerve-wracking for everyone. But I am confident that we can safely reopen New Brunswick schools. We have a plan to address outbreaks of COVID-19 where and when they happen during the school year.
Working closely in the Department of Education and Early Childhood Development and school districts to ensure that schools can reopen safely and that parents and teachers can feel confident that the health and safety concerns are being addressed. Puis c'est pas différent que tout au
And that is not different from what we did throughout the pandemic, all the work that public health did with companies, associations, while the different parts of the economy reopened. So we did all this safely, thanks to the advice that we shared and that the Public Health Agency of Canada shared.
Canada with our counterparts across the country, sharing information and resources and direction with each type of business and each type of association as things have been able to open up within New Brunswick. And so this is no different. We have strong working relationships with the Department of Education at the provincial level and at the regional level, as we have in other areas and other concerns in the past. The Parent and Public Guide being released today is the result of the collaboration and is endorsed by Public Health. I want to be very clear that this is a plan for managing risks, not eliminating them. There will be further outbreaks of COVID-19 in our province, and it is possible that with some of these future outbreaks, they will impact one or more of our schools. And in fact, at the provincial level, we have been doing tabletop exercises to practice these scenarios. Alors, au niveau de la province,
At the provincial level, we've done tabletop scenarios where we practice the effects and situations of outbreaks in one school or several schools at once. I want to be very clear on the fact that this is a plan for managing risks and not eliminating them. There will be further outbreaks of COVID-19 in our province, and it is possible that some of these future outbreaks will impact one or more of our schools. But we are moving forward because the cost of keeping our schools closed indefinitely must be weighed against the impact a long-term closure would have on the young people of New Brunswick.
Weighed against the impact of a long-term closure would have on the young people of New Brunswick. Getting back to school is vital for our children. It is important that they continue to get a properly structured education. And this information and these conversations and discussions have been taking place with our public health colleagues across the country, the Chief Medical Officers of Health, and Public Health Agency of Canada. So it's not something that is taken lightly, and all of this information has been shared with the Department of Education in the planning process, along with jurisdictional reviews, etc. Alors, les discussions sur l'importance de
So discussions on the importance of education for our youth have taken place with all the chief medical officers of health of all provinces and of Canada. So this is very important, and we are convinced that the steps and the processes that were implemented are the most safe, and while we get more information, we are ready to change the advice that we give depending on the research that is being done.
Data and research is available. We will continue to input that information with our colleagues in education, and if there are changes that we will need to make, we will make those changes as we move forward. C'est nécessaire pour leur santé mentale et leur développement social.
It is necessary for their mental health and their social development. We all want this to happen as safely as possible, which is the aim of the plan outlined by Minister Carty here today. We all have a role to play in ensuring the success of this plan.
Students are ready to deal with this new normal and understand what is happening in the world around them. Comme parent, je connais que c'est quelque chose qui cause de l'anxiété, qui cause des...
As a parent, I realize that this creates anxieties, concerns, and I'm a parent. My children will be in school with your children, so I understand your concerns.
Will be in school with your children, so I do understand what concerns you have at this time. And as Minister Carty said, we will be here to answer questions as they come up. And again, we are very concerned that everything goes as planned and rolls out as well as possible, with as much information sharing as possible, so that everybody feels comfortable, knowing that it is very normal for this anxiety and it's very normal for these concerns to be at the forefront of your minds right now. It is particularly important that we reinforce the things that children can do to keep themselves healthy. They can limit their contact with other students by staying in their classroom bubble. They can wash their hands regularly and thoroughly several times a day. Alors, il y a des choses qu'on peut faire avec les enfants.
So there are things that we can teach children so that they stay safe, and it is important to reinforce these measures with the children so that they can remain healthy. They can limit their contact with other students by staying in their classroom bubble. They can wash their hands regularly and thoroughly several times a day.
They can wear a mask to limit the spread of the virus. Est-ce que vous connaissez des gens qui ont besoin des masques? C'est le temps maintenant pour faire sûr qu'on a le support pour maintenir toutes les...
Do you know people who need masks? Do you have masks? Are you ready? Can someone stay home? Have you had conversations with your employer so that while situations occur, you are ready?
If your child has to stay home and self-isolate, can you stay home with them? Have you had conversations with your employer about that? Do you need masks? Now is the time to get ready and prepare for that support that you will need as you go through the school year. Parents will be primarily responsible for monitoring their children's health and keeping them home when they aren't well. Teachers and staff have also been trained to watch for common symptoms of COVID-19. But even with all these precautions, the COVID-19 virus may find our way into our schools. And again, we're expecting this and we're preparing for this. And I think just as we've had fire drills, we've had lockdown drills, people understand what to expect when these things happen, and that's part of the preparation, is preparing people's expectations about what's going to happen in the event of an outbreak. Alors, comme on a fait des exercices pour les feux, des exercices...
So we have fire drills, we have sudden school closure drills. We practice all this. We have expectations so we can have the processes in place to know what we will need to manage.
What will happen when a positive case is discovered in a school setting? And I'm not saying if, I'm saying when, and that is what we're prepared for. When a positive case, and I don't mean somebody who is being tested, so I'm going to pause right now and repeat what I've just said. I'm not talking about when somebody is being tested. I'm talking about when a positive case has been diagnosed. Here in New Brunswick, our positivity rate is for every 1,000 people who get tested, who have symptoms, only one person is tested positive. So that means there are 999 people who get tested who are negative, and only 1 out of 1,000 tests positive. So if every time a person is tested, that means that 999 people would be worried and concerned, and if they shared that information with other people and they acted on it, for instance, in situations where businesses have been shut down and people have been sent home from work, that is quite disruptive. So we wouldn't want to see that in schools. So just remember the fact that it's a diagnosed case, not somebody who is being tested. So when a positive case is identified with a student or staff member, public health will advise the school, who will in turn communicate with parents in the school and the community. Public health will be responsible for contact tracing, and the classroom bubble will be helpful in determining who should be contacted. Some individuals may be required to self-isolate to limit the spread of the disease. This could be a few people, a classroom, multiple classrooms, or even an entire school, depending on the level of contact with the infected person, depending on how public health staff assess that risk. And I can tell you that my regional medical officers of health have been doing an amazing job up until this point with the teams in the regional, in the regions to make this happen with the outbreaks that we've already seen and the continuing cases that we have seen. A single case of COVID-19 will not automatically trigger a closure of a school. Si un élève ou un membre du personnel
When a positive case is confirmed in a student or staff member, public health will advise the school. And I will pause here because I want to reinforce the message. It's when there is a confirmed case, not just when someone gets tested. In New Brunswick, for every 1,000 people tested because they have symptoms, only one tests positive, which means that 999 people who test for COVID-19 are negative, which means that we cannot close schools, businesses when people get tested. It's only after someone was diagnosed with COVID-19 that we do the contact tracing, and in that case, public health, our staff, will contact people at risk. So we really must remember this information because this is the process for a diagnosed case. Public health will be responsible for contact tracing, and this classroom bubble will be helpful in determining who should be contacted. Some individuals may be required to self-isolate to limit the spread of the disease. This could be a number of people, a classroom, multiple classrooms, or even an entire school, depending on the level of contact with the infected person. But a single case of COVID-19 will be determined by public health.
It may be difficult for parents because you may not receive all the information you might want in the event of an outbreak at your child's school. And again, as a parent, I can understand that type of frustration, but again, you have to trust in the process and trust in how our regional teams in public health are going to be managing these outbreaks. And again, the success that they've had in managing the outbreaks thus far. We have a requirement to protect the privacy of individual New Brunswickers, so only affected persons and families will be contacted. This is very important. C'est très important de protéger la
It is very important to protect the privacy and the identity of the people. We don't want anybody to be labeled.
We are going to be living with COVID-19 for a very long time, and this is going to be part of the normal process of how we're going to be living with it. If you learn of an outbreak at your child's school, not hearing from public health is a good thing. Public health contacts those who need to be based on a risk assessment. Si vous apprenez qu'il y a une éclosion dans l'école,
If you learn of an outbreak at your child's school, not hearing from public health is a good thing. We're embarking on an untraveled road as we begin this new school year.
begin this new school year. None of us has been through a September like this one. And the challenges ahead will require bravery, wisdom, compassion, and kindness from all of us. They will require active vigilance, active caring, so that our students stay healthy and safe. We can get through this by working together and supporting each other, and I can't underline that enough. We really need to support each other. Les défis qui nous attendons, nous demanderont.
The challenges ahead will require bravery, wisdom, compassion, and kindness from all of us. They will require active vigilance and active caring so that our students stay healthy and safe. We can get through this by working together and supporting each other. Thank you very much.
Merci, Monsieur le Ministre, et merci, Dr. Russell.
Thank you, Minister. Thank you, Dr. Russell.
We'll have one question and one follow-up. You can pose your question in the language of your choice. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aurait une
Each reporter will have one question and one follow-up question. And you can ask the question in the language of your choice.
Thank you. My question is for Dr. Russell. Dr. Russell, does a return as well as the onset of colder weather mean that as a province we should increase the amount of overall testing New Brunswick is doing for fall and winter, or perhaps even adopt a more random testing strategy to prevent outbreaks?
Hi, Vicki. So our testing strategy right now is being worked on by our public health teams, and in terms of how it works with the schools opening and winter weather, there is no plan to change things at this time, but certainly the goal has always been to make sure that our testing reflects what we will need to know to be confident that there's no community transmission, et cetera.
Thank you, Dr. Russell. Vicki, do you have a follow-up?
I do. It's for Minister Carty. Thank you. Minister Carty, for rural high schools with smaller classes but inadequate community infrastructure, will the option be made available for those schools to continue daily in-person classes for all students, provided social distancing measures are met?
Hey, Vicki, thanks for the question. And the individual school plans I mentioned are going to be left up to those schools as long as they meet the parameters for physical distancing, for exactly the safety measures that you mentioned. So, there's obviously a big difference between a small rural school and a large urban one. There are some schools in the province which have been struggling with declining enrollment. Others where the playgrounds are filled with portable classrooms. So, there's hugely different realities there. So, yeah, we're letting the schools give us their plans. We want to keep things as normal as we possibly can. Pour répondre brièvement en français, oui.
So yes, absolutely, for each school there will be an individual plan to ensure that they meet the needs of each community, school community. For small schools, small high schools, yes, they could probably return to normal, but in large urban schools with lots of students, with lots of portable classrooms, that will be different with different measures. But the schools will manage the health and safety of the students, and they will be following the parameters set by public health.
First question, please.
Thank you. This plan says parents are to monitor their children daily. Will schools be doing any health monitoring for students and teachers?
Sorry. Who is your question for?
Either, but I guess Minister Carty?
So my understanding is that the parents are responsible for making sure that their children are well enough to go to school and don't have symptoms. But certainly if it's noticed by a teacher, then that would cause somebody to be contacted at home, obviously, which is the case today. If children are unwell at school, I'm sure teachers and principals are aware of that. And if a child is unwell, they do contact the parents.
Thank you, Dr. Russell. Adil, do you have a follow-up?
Yes, I have a second question, but just to confirm, will there be monitoring for teachers?
I think it would be very important for all staff and teachers to be self-monitoring all the time, and we would not want anybody to be going to the school who is not well and has any kind of symptoms that could be related to COVID-19.
Thank you. And my second question is for Dr. Russell. Last week you announced physical distancing will be reduced from 2 meters to 1, provided that people wear a mask. In this plan, students are 1 meter apart but not wearing masks. How prudent do you think this is?
That's a great question, Hadil, and I think a lot of parents and staff would be asking the same question. So with public health being involved in all of the advice and all of the planning, we are confident that we can do this safely. Again, if people are staying at home when they don't have symptoms, if our numbers of total cases in the province are kept low, if everybody, even outside the school system, is following public health directions, then I think we're balancing the risk of keeping kids home indefinitely during the pandemic and allowing them to have as normal educational experience as possible, knowing that the social development, the educational development, psychological well-being of kids is very, very important and very dependent on being able to attend school. But my understanding is that, again, this information contained in the guidance documents has all been endorsed by public health.
Thank you, Doctor. Thank you, Leah. Alexandre Boudreau.
Alexandre Boudreau. Hello. I am wondering what will happen if several students go to school without a mask. Will the schools have spare masks, or will they be sent home? Did you plan for something when this happens? Thank you for the question. We will look to those policies. We'll see. This is a matter of discipline in the school. We don't want to give a new mask every day to each student. So this is the expectation that students will be wearing a mask. If a student forgets a mask one day, that's all right. We'll help them out. But obviously, we cannot give a mask every day to every student. But that's not the kind of investment we want to make. We want to make investments for the health of the health and safety of school and of school students and teachers.
One day, we'll provide you with a mask. If you forget 2 days, you're going to start to get the raised eyebrows. The goal is to make sure that students obey the rules. Like everything else with school, there'll be challenges with that, but I'm sure that our teaching staff is up to it and will be there to give them the backup that they need. I hope that answers your question. Merci.
Simonist. Alexandre, avez-vous une suivi?
Alexandre, do you have another question, a follow-up question? Yes, so for high school, how will you determine which students will have to be in school one day and which students will have to come the second day? I think this can get complicated with large high school populations. How will this be determined on the ground? So how we will decide this? Well, so this will be part of each school's individualized plan because every school's needs are different. Like I said earlier, in some schools there won't need to be many changes because there aren't that many students in the schools. In other schools, it will be absolutely necessary. So we can discuss this in details in the coming weeks. One thing I must say is that from experience, well, every person's experience will be different. Every experience will be different, but not that complicated. So all the different rules that we are discussing today, I want everybody to remember that it's not that complicated. It will just be the experience for each student that will be a little different from last year, but I hope that it will be as simple as possible. I think that after the first and second weeks, it will become routine, normal, until we can get a vaccine and put an end to this pandemic.
How we're going to figure out how to deal with the blended learning for the high school students, it'll depend on the size of the school and the individualized plan from each high school. And we'll be talking about that in more detail in the coming days and weeks. But also just wanted to underline something important, that for each family and for each student, they're going to have one day at school. They're going to get on the bus or not get on the bus, depending. And I want to give a shout out to all the parents who volunteered to drive their kids to school this year. It's making a huge difference. Their kids will go to school, they'll go to classes, there'll be a new routine just like there is every year. Certainly going to be a little bit more different than usual, but in the end, after a couple of weeks, it's going to be the routine. And so I'm really aware of the level of anxiety that all of these new rules and plans and everything else can create. But I'd ask everyone to remember that for you, all that's really going to matter is what happens with you and your family and your children. And that's a lot simpler. And yes, it'll be a bit of adjustment, but I hope that after 1 or 2 weeks, we'll carry on with this and get used to this, that awful phrase, the new normal, until we can have a vaccine, get the population vaccinated, and put this pandemic behind us. Thanks.
Merci, Monsieur le Ministre.
Margot Castader, Radio-Canada. My question is to Minister Cardy. Are teachers going to be responsible for policing the wearing of the masks in schools? Thank you for the question. I take exception to the fact that the students are going to be, teachers are going to be the police. They are here to teach students how to behave. So masks are just a little thing that are added to a long list. I'm sure that everybody who's been through the school system can remember all the rules in place. So it's just one more thing to add to the list. I am absolutely confident that our exceptional school team is willing to take on this responsibility because they realize that this is a global pandemic, this is serious, and it is the only way to guarantee that our population can survive this pandemic and to take measures to ensure that we stay healthy.
Enforcing mask rules, I don't think that's really accurate. Teachers are there to teach. And in this case, part of what they're doing is, yes, protecting public safety by enforcing the mask rules that have been announced today, but also they're teaching kids how to care for themselves and for their fellow students and for the community around them. And that's how we've gotten to the place that we are right now in this pandemic, which is one of the best in the whole world. So let's keep that up. And our teachers are there to help the next generation get ready for how to deal with a pandemic. We never thought we'd need that lesson. Turned out we did. I've got no doubt our teachers are going to continue their exceptional work in preparing our students to deal with a changed future that, sure, we couldn't have imagined it, but our teachers are up to the task. Thanks.
Merci, Monsieur le Ministre. Margot, avez-vous un suivi?
Oui, merci. Ce sera toujours pour le ministre.
Yes, I have another question for Minister Cardy. Will the department give additional resources in terms of staff or budget to the schools and districts to get ready for the new norms? Absolutely. It would be impossible to address a pandemic like COVID-19 without additional resources. So we hired additional staff, about 150 members of the Teachers Federation, 66 bus drivers, and we added 10% to the number of people cleaning the schools. So in terms of human resources, there is a great investment. Like I mentioned in my speech, we are replacing the drinking stations with water bottle filling stations. We are adding cleaning stations in each classroom of every school. So that's adding $75 million to the regular budget to address COVID-19.
Something like COVID-19 without spending money. So we've hired around 150 new members of the Teachers Federation, both English and French sectors. We've got about plus or minus 70 new bus drivers, and we're adding about 10% to our custodial staff. We're replacing water fountains in every school with water filling stations. And we're making sure that every single classroom in every single school has access to a cleaning station. So we're making the investments that are needed to keep our kids safe, to keep our teachers safe, and all the professionals who work in our schools. Thanks for the question.
Merci, Monsieur le Ministre. Merci, Margot.
Merci.
Thank you.
I'd like to hear from Minister Carty and Dr. Russell on this one. School policies on masks differ widely across the country. I just wanted to know how you landed on what you did, and if there was a model of a policy from another province that you followed, and then for Dr. Russell just to talk about why it is different in every province.
That's.
Oh.
Sorry? Do you want to go first? Yeah.
Hi, Adam. So the discussion around masks at the national level have been ongoing since the very beginning of this pandemic. And in the information that we receive in terms of the research and evidence and studies continues to evolve. And so those discussions continue to happen as recently as this week. So we meet twice a week with the Public Health Agency of Canada as well as the Chief Medical Officers of Health from the country. We have shared across all jurisdictions what the masking policies are in each school. And at the end of the last discussion on Tuesday was, we need to discuss it again. So wherever we land right now, it could change. So we're just going to deal with the information that we have today, knowing that more information is coming and will continue to evolve. So if you look at the different jurisdictions and what people are doing, it's a little bit all over the map, and it's because, again, the information that we get from Public Health Agency of Canada and all the studies that we're looking at in great detail continues to evolve. So I think parents and staff have to be flexible right now in terms of we're gonna make decisions based on what we know today, and as things change and evolve, then we're gonna make new decisions as needed.
Yeah, Adam. The only thing I'd add to what Dr. Russell said is that from the very beginning of this pandemic, my approach has been to look at what's happening around the world and to take an approach that balances, as Dr. Russell has put it in every one of her statements, the educational needs of our students and the need to protect them and make sure that they're safe. And of course, by extension, the safety of the professionals who work in the school system as well. And so far, I think we've managed to achieve that balance. And with the help and guidance of Dr. Russell in public health, we've been out in front on a number of different files since the beginning of this pandemic, and it's one of the reasons that New Brunswick is doing well. So we're going to continue to follow that approach because it's working, but to do that, we continue to need the help of New Brunswickers. Because I've said a couple of times already, and Dr. Russell has said, we're going to say it in probably every one of these briefings, the way to keep our schools safe is to keep New Brunswick safe. And if we can keep COVID-19 out of this province and prevent community transmission as much as possible, that's the best way to keep our schools open and safe. We will have setbacks, we will have more cases, we will probably have cases in schools. But the more that we can follow the rules that are becoming familiar to all of us with social distancing, the use of masks when appropriate, that's the best way that we can keep our province safe and our kids safe. Alors, juste pour ajouter brièvement qu'est-ce que Dr. Russell a dit.
So to add to what Dr. Russell said, we must be aware that the best way to protect our school system is to protect the province, to make sure that there is physical distancing, to use and wear masks, and to listen to global experts. Up until now, this is what enabled us to be in this positive situation. Thank you.
Adam, Mia Urquhart, CBC.
Could I get the follow-up, please? Sorry.
Quick one.
Yeah. Dr. Russell, you addressed how all parents of a school won't be contacted if there is a COVID case found. To drill that down a little bit, would the parents of everyone in a class be contacted, or could it just be the one student's pulled and then that's it, no one hears the rest about it?
So, Adam, I can't break down what's going to happen in each individual situation because each individual situation will be addressed by the public health regional teams. And so who is contacted will be determined by what the public health regional teams determine in terms of the risk. So if there's a risk that a child is a close contact, they will be contacted. And if there's a risk that they're not as close of a contact, they may be contacted not for self-isolation and or testing, but they may be contacted to say they need to self-monitor. And that's been the case throughout the pandemic. The process will not change just because it's happening in a school. The process has been in place since the beginning of the pandemic that when somebody is diagnosed, the close contacts are contacted, and if somebody is considered to be a lower risk contact with respect to not having as close contact, they would be told to self-monitor, and those people would be told either individually or they'd be told at the classroom or school level. And that's been the same case in terms of businesses that have been affected. If an individual tested positive, the close contacts were contacted and told to self-isolate, and then anybody who might be a contact that was less of a risk, then those people would be told to self-monitor.
Thank you, Doctor. Thank you, Adam. Mia Urquhart, CBC. First question.
Thank you. My question is for Mr. Carty. The plan says high schools that can maintain physical distancing at all times won't have to have alternating attendance. So how many of those high schools exist in the province, and have those parents been notified that their kids will be going every day?
Hey, Mia, thanks for the question. Not yet. Again, that's down to the individual school level. We'll have a lot more details on that and how this high school system is going to work over the next week or so. So that's all the information that'll be coming out in the next little while. So just pour les écoles secondaires.
For high schools, the high schools that won't need to have a blended learning environment, well, we will get the information in the coming days.
I do, thank you. What if a parent is an essential worker, say a truck driver, who travels to other parts of Canada and must self-isolate when he or she comes home? What if they have school-aged children and self-isolate in the home? Do the kids have to as well, or can they go to school?
So our advice about self-isolation and essential workers and what's been in place right now for daycares would be very similar in the sense that obviously the risk, I'm going to break this down in a couple of ways. One, an essential worker who is work isolating, they are only required to self-isolate if they are directed to, with respect to if they are diagnosed as a case, because right now we are allowing essential workers to work isolate, but not necessarily self-isolate at home. Would it be prudent for family members of people who travel in and out of the province on a regular basis to self-isolate? That would be prudent. And especially knowing that we're going into a period of time where we can't predict what's going to happen with respect to the school setting and the risk of outbreaks. We are planning for all of those things, but we can't predict exactly how it's going to look and feel. What we do know, and this may reassure some people, based on the evidence and research as of today, which can change and can evolve, what we're seeing is the pattern of transmission from child to child is very low. So the likelihood of a child getting infected from another child is low. It's not zero, but the higher risk is for a child to get infected from an adult. So I think what we could expect to see is either children being infected in a household environment or close contacts of the household, or in that kind of a setting and bringing it to school, or an adult bringing it to school. So I think we just need to remember that the risk will never be zero. Whatever precautions we can take, we should be taking all the time. And so, you know, I think the idea of gatherings being a high risk setting for transmission, when school gets back up and running, I think we have to make very, very conscious choices and decisions about what each household member is doing. I think at the school level, there's probably no more things that we can put in place than we have right now in terms of protecting the school population, the staff, students, etc. We have those things very clearly delineated. But what we really will need continued support and continued help with from each individual in this province is what you do as individuals in your household and who you interact with outside your household moving forward, because I think that is what's going to be critical with respect to success during the school year.
Thank you, Mia. Travis Fortnum, Global.
Hi there. My first question is for Minister Carty. We touched on some of the extra investments being made for the school year, such as custodial staff and bottle filling stations. I'm wondering if we know if those will be in place for the start of the school year, or if it'll be an ongoing rollout.
The expectation is that we'll have those measures in place for the system in September when schools restart. So that's the goal. And if there's any updates on that, I'll let you know, but that's the intention. Alors, l'intention d'avoir les mesures de sécurité pour la...
So we intend on having those safety measures in place when school starts. If there are changes or exceptions, I will mention them in the coming weeks.
I do, and probably Minister Carty would be best to respond to this as well. I know it's hard to deal in absolutes, especially in a situation like this, but something stated in the plan and something you touched on a little earlier is that in the event of an outbreak, learning will continue. Is that the case even if the province as a whole sees a wave to the degree of what we saw earlier this year, or even worse, perhaps?
Yeah, like you said, it's hard to deal in hypotheticals, but our intention is to keep the school systems open as long as Dr. Russell lets us. L'intention d'assurer que le système scolaire reste ouvert.
We intend on having the school system open until Dr. Russell says that it's not safe to do so. We must keep educating our children.
Otherwise, we'll be creating a lost generation, and I don't think any of us want that.
Thank you, Minister. Thank you, Travis. Charles, caméra, TVA, votre question, s'il vous plaît?
Oui, ma question s'adresse.
My question is to Minister Carty. You didn't mention it in the press conference. Maybe you will mention it in future press conferences. It is about the assistance program for laptops and technology equipment. Will this be in place before the beginning of the school year? This is something that we will address in the future press conferences. For people with low income, the assistance program is up to $85,000 a year. So it's not exactly a low income.
Students in particular, that we will be handling all the detailed questions around that in the briefings that are going to be coming up over the next couple of weeks. It's a program that applies to all families who earn less than $85,000 combined income. We do take into account as well adjustments caused by COVID. If you had a full-time job last year and lost it because of COVID-19, we're going to base the assessment for subsidies on your new salary, not the pre-existing one.
Merci, Monsieur le Ministre. Merci, Charles. Avez-vous une suivi?
Oui. Ma question.
Do you have a follow-up? Yes. This question is for Dr. Russell or Minister Carty about cleaning protocols and the safety of staff and testing. Will this be the same for every school and school districts, or can it vary just like operational plans vary? The standards are centralized. So those standards are for all schools with the support of districts.
We're setting the standards provincially. It's up to each school to figure out how to meet those standards, but they are those central standards, and they will be enforced. And that is absolutely, we have to make sure that everyone is equally protected when it comes to health and safety. And I know we're going to be wrapping up soon. I want to just take one moment and thank the folks who have been doing our translation and sign language work, because I know that I speak far, far too fast. I've been trying my best to be a bit more reasonable today. I just want to thank you very much for the work for the folks behind the scenes who have to go through a lot of stress from the folks of us behind this podium from time to time. So thank you to them.
Merci, Monsieur le Ministre. Merci, Charles.
Merci.
That concludes.
Thank you.
Voilà la fin de notre mise à jour. Merci.